Good evening. My name is Jennifer. I'll be your moderator this evening. I'd like to welcome you to our webinar, Treatment Options for Overactive Bladder, presented by Dr. Aisha K. Taylor. I would like to introduce Dr. Taylor, who is a fellowship-trained physician in female pelvic medicine and reconstructive surgery. She specializes in female pelvic reconstructive surgery as well as women's urologic conditions, of course, including OAB, stress and urge urinary incontinence, voiding dysfunction, pelvic organ prolapse, vulvar conditions, urologic conditions in pregnancy, and chronic pelvic pain. Prior to joining Chesapeake Urology in March 2019, Dr. Taylor was an assistant professor in the Department of Urology at the UMPC Magee Women's Hospital in Pittsburgh, one of the nation's top hospitals specializing in women's health care. Dr. Taylor received her medical degree from Harvard Medical School and completed her residency in urologic surgery at Northwestern Memorial Hospital before completing her fellowship in female pelvic medicine and reconstructive surgery at Case Western Reserve University. She's a member of the American Urological Association, the Society of Women in Urology, and the Society of Urodynamics and Female Urology. Welcome, Dr. Taylor.
Thank you. I want to welcome everyone who has joined the webinar this evening for this very, very, very important topic where we're going to be talking about regaining control of your bowel and bladder function. Just to reiterate, I have a specialty in female pelvic medicine and reconstructive surgery, and that's just a complicated word for telling patients that I am a lead urologist. I care about all things related to women's pelvic health, their bladder, their kidneys, and my mission is to help women live their best lives. Part of what I do is managing bowel incontinence and bladder incontinence, and that is what we're going to cover today. Bowel and bladder symptoms can really have a negative impact on your day-to-day function. So if you can relate to some of these comments on the slide, like if you find that you're drinking less before you go on a trip, or if you find that when you're out and you're at a movie, when we were able to go to the movie theaters, and you often miss the best part of the show because of a bowel or bladder accident, or if you find that you make a bathroom plan when you're leaving your house, and even though you know where every single bathroom is, you still worry that you won't make it, this is the right talk for you. Know that if you do relate to those statements, you're not alone. You're actually in good company, because there are lots and lots of women who have bowel and bladder issues. In fact, out of the 330 million people we have in the United States, 50 million women suffer from overactive bladder, and an additional 20 million suffer from fecal incontinence. We believe that that number is actually significantly underestimated because patients don't realize that treatment is available. They think that they are alone, and they are embarrassed to talk about it with providers. That is evidenced by the fact that only half of those affected by the above conditions that have the most severe of symptoms seek treatment. Most people just think this is how it has to be. So let's talk about an understanding of conditions that affect your bowel and bladder. So your symptoms, if you could relate to the earlier slide, may be related to the condition of overactive bladder, which is characterized by sudden urges to urinate and an inability to hold or control your urine. Oftentimes, women may have a condition called urinary retention, which is characterized by difficulty completely emptying your bladder. The third category is fecal incontinence, which is the involuntary loss of stool. So let's just review normal bladder function. So you have the brain, and the brain sends a signal down the spinal cord. The spinal cord connects to a nerve that comes off your tailbone, which goes to the bladder. So as your bladder fills, it sends a signal back up this nerve, entering through the pelvis, up the spinal cord, and to your brain, telling your brain it's time to empty your bladder. The brain then sends a signal down the spinal cord to this nerve that travels from that pelvic bone to your bladder, telling the bladder it's cool and empty. The bladder then squeezes, the urethra relaxes, the pelvic floor relaxes, which results in normal voiding. Your bladder will force the urine out, the urethra will make sure your bladder is empty. So what is overactive bladder? Overactive bladder is an abnormal process between the brain and the nerve that feeds the bladder. So an overactive bladder is the frequent and urgent need to empty the bladder, and it often can result in unintentional urine loss. Some symptoms associated with overactive bladder include urinating, usually 8 or more times in a day. You may have urinary urgency where you feel a sudden sensation that you have to pee and you can't get rid of that urge and it's difficult to control. Urge incontinence is when you have that urgency, but you have a subsequent incontinence or involuntary loss of urine. And finally, there's nocturia, which is when you get up 2 or more times to go to the bathroom at night. So what goes on in the overactive bladder? Well, I already told you the problem is the nerve that goes to the bladder. So that signal between the brain and your bladder is disrupted. The nerve traveling to the bladder sends repeated signals to the bladder, resulting in repeated bladder contractions, which will result in you feeling an urgent need to urinate. You're going to rush to the bathroom, and you may even leak or use urine before you make it. So let's start talking about normal bowel function. No surprise here, the same nerve that is involved in bladder function is the same exact nerve that goes to the bowel. So usually when the rectum fills, and this is the end part of the colon here, when it's distended with stool, that stool sends a signal to stretch receptors that are located in the wall of the colon. That sends a signal up the nerve that is in the pelvis, up the spinal cord to the brain, and that tells you, yeah, it's time to empty our bowels. If it's a socially appropriate time, your brain then sends a signal down your spinal cord to that nerve, the sacral nerve 3 in your pelvis, that leads to the colon and allows for the contraction and evacuation of the rectum for stool and the relaxation of the pelvic floor muscles so that you can evacuate the stool. So what is fecal incontinence? It is the situation that occurs when that nerve pathway is not functioning properly. The nerve is firing, sending that signal up to the brain sending the signal back down, which results in an uncontrolled loss of solid, liquid, or even mucus. Your symptoms, if you have fecal incontinence, can include stool urgency, which is the sudden urge to pass stool that's uncontrollable. It can be fecal incontinence when you get that sudden urge to pass a bowel movement, but you're unable to stop the urge and you have a stool accident. And finally, there's passive fecal incontinence, which is the leakage of stool when you're not even aware of it. You just look down in your undergarments and you may see streaks. So these are all symptoms of fecal incontinence. Please understand that if you have these conditions that I just highlighted, it's not normal. It is not a normal part of getting older. Do not accept that. And it does not have to do with, oh my gosh, I'm just a woman and we go through these things. And there's nothing that you actually did to cause that. If you're having these symptoms, you don't have to live this way. You totally deserve better. If you have these bowel and bladder symptoms, it can have a really big negative impact on your quality of life, leading you to avoid physical activities, reduce your social interactions, avoid travel plans. You may suffer from depression, guilt. You may self-isolate because of this. You may not have the best intimate situation with your partner. You're avoiding sexual contact because this is so destructive in your life. It may lead to absence from work and decreased productivity if you're going to the bathroom frequently. And it results in a substantial cost if you're buying incontinence products. They're very, very expensive and not often covered by insurance. But rest assured, there's good news. There are treatments to help you regain control of your bowel and bladder symptoms. So let's review some of the treatments that are available. So we have algorithms, and it all starts with identifying that you have those symptoms, knowing that there's nothing to be embarrassed about because you are in good company with a number of people in the country that are suffering from these conditions. Once you understand that there is treatment, you can consult with a physician. You can discuss your symptoms. We can start with a baseline diary, review what your day to night bladder symptoms are. You may undergo some testing, and then we can talk about some treatment options. The initial treatment being bladder training exercises, lifestyle changes, prescription medications, and when those fail, advanced therapies, which I'll discuss very shortly. There's a similar pathway when it comes to fecal incontinence, either the urgency or the actual accidents or soiling. First, know that you're not alone again. Second, there's nothing to be embarrassed about. Third, there's treatment. You can consult with your doctor. We'll get a baseline analysis of what your symptoms are and get a bowel habit diary. You may undergo tests such as colonoscopy and some assessments of the muscles surrounding the anus and rectum. We'll discuss treatment options, including initial treatment such as dietary changes. Some people find that they may be lactose intolerant. They may discover that they have celiac disease and can't tolerate gluten. In situations where there have been prior surgeries, strengthening the muscle around the rectum and anus and doing pelvic floor exercises may help your symptoms. There are also over-the-counter medications, the anti-diarrheal medications that may help. But when those don't work, you follow up with your physician who will offer you advanced therapies, including sacral neuromodulation. There is transanal irrigation. In severe cases, there is actually reconstruction of the anal sphincter and muscles surrounding the rectum and anus, and also a creation of a new sphincter. So delving into the initial treatment for overactive bladder, when we talk about behavioral modifications, we're talking about stuff that you can do. There are techniques such as when you feel the urge and it's intense, you can simply squeeze your pelvic floor, and that may trigger the bladder to stop squeezing. Those are known as Kegel exercises, and not everyone knows how to do that. So we do offer for patients who don't have a good sense of how to work their pelvic floor, consultation with a pelvic floor physical therapist who will help you to know which muscles those are that are important to engage, and to give you good feedback in terms of knowing when to use those muscles and know you're using them in the right way. Other strategies include bladder retraining, such as if you get the urge to go, tell your bladder, I'm waiting 5 minutes. You increase that interval each time until you're able to hold your bladder more. Other things you can do include lifestyle changes. So there are a number of things that can impact how your bladder is acting. If you're drinking a lot of fluids, your bladder is going to make a lot of urine. So simply cutting back on some of your fluids can help reduce your symptoms. Caffeine and alcohol are notorious agents that cause the bladder to be seriously irritated. The result is uncontrolled bladder contractions. You're going to the bathroom frequently through the day and through the night. So simply cutting back on those things may result in a substantial improvement in your symptoms. When your behavioral modifications, including bladder training exercises and lifestyle changes, have failed to improve your symptoms, that's when one of us will offer you a medication. Now, there are 2 different classes of medication. One known as the beta-adrenoceptor agonist, which promotes bladder relaxation, which allows you to hold more urine. And there's another class of medications known as antimuscarinics. They specifically block the bladder from squeezing. That results in the frequency, urgency, and sometimes a leakage that occurs. When you have tried two medications or more and they have failed to improve your symptoms substantially, or you have intolerable side effects, dry mouth, constipation, or an increase in your blood pressure, it's time to revisit a specialist who will offer you third-line overactive bladder therapies. So I'm going to review these therapies, and I just want to remind you that when it comes to the bowel and bladder, remember the nerve is the issue. So that nerve that's running from the pelvis to the bladder is overfiring and is causing the bowel and the bladder issues. So our treatments are aimed at targeting the nerve. The most indirect way to target the nerve is through a process called percutaneous tibial nerve stimulation. So the tibial nerve is a nerve found in the ankle, and it travels up the leg and finds itself in contact with that very tricky, bad performing nerve that's in the pelvis. It's an in-office treatment. Acupuncture-like needle is inserted in your ankle, and it sends an electrical stimulation up that nerve to the pelvic sacral nerve. And through 12 weekly sessions that are 30 minutes each, some patients may experience a substantial improvement in their symptoms. After a 12-week course of initial therapy, if you experience a substantial improvement that you're happy with, you simply have to come back once a month for maintenance therapy. Focusing on a target of the nerve at the level of the bladder is Botox. Now, we've been using Botox in the bladder for neurologic bladder conditions, such as multiple sclerosis, stroke, or some spinal congenital abnormalities since the 70s. Botox injections in those conditions back then resulted in a substantial improvement in frequency, urgency, and leakage associated with the overactive bladder related to nerve damage. In 2012, Botox was approved for use in people who had these symptoms without a neurologic cause. The medication is injected through a cystoscopy after your bladder is numbed for 20 to 30 minutes, and the medication is injected along the bladder wall. It takes 2 to 3 weeks for the medication to take an effect and relax the bladder. And if you have a positive outcome, you only have to have this repeated every 6 months. So it's a good therapy for some people, and they do well for a long period of time. There is a small risk of urinary retention, but that's only in less than 5% of patients. And some women have found that this therapy is very, very helpful in managing their bladder symptoms. Finally, we have sacral neuromodulation. Sacral neuromodulation is the only therapy we have that targets that problem child, that sacral nerve specifically. We've been using it for several years, and although there's been a period of stability in the last 10 years where we haven't had much changes in the therapy, we previously only had a device that was non-MRI compatible, that required you to get battery changes in the operating room every 3 to 5 years. But in the last 5 years, we've had a revolution with this therapy. Sacral neuromodulation directly modulates the activity of that pelvic nerve, helping to restore bladder and bowel control. The therapy is done in a trial fashion, and it's a simple procedure. And if and only if the trial is successful, do you have a permanent implant that's placed that can provide therapy for up to 15 years. So let's talk about the newest, latest, greatest sacral neuromodulation technology, and that's Axonics. So what is Axonics therapy? Axonics therapy is that wonderful sacral neuromodulation therapy that is a guideline recommended therapy that restores normal control of the bladder and the bowel. It is indicated as a treatment option, not just for overactive bladder symptoms, but also for those with retention. So Patients who might not be able to get Botox because they already have some degree of incomplete bladder emptying are an excellent candidate for sacral neuromodulation and specifically Axonics therapy. Finally, it is a guideline recommended therapy indicated in the treatment of fecal incontinence, also known as stool accidents. So how does the therapy work? Axonics therapy, through a nerve wire that is in direct contact with that nerve in your pelvis that sends all the signals between your bladder, the spinal cord, and brain, it provides gentle stimulation to the nerve to restore control of the bowel and the bladder. The stimulation can restore the normal communication that's missing when the nerve is just doing its own thing, such that the brain regains control of the bowel and bladder, which can ultimately result in a substantial improvement in your symptoms. Axonics actually offers a miniaturized implant that is the size of an Andes candy. It safely delivers therapy with a very tiny battery that's rechargeable. It's placed through a minimally invasive outpatient procedure, and the battery is designed to last up to 15 years. And this is pretty accurate with the size of the quarter. It's small, it's light, it's cute. In addition, Axonics is currently the only sacral neuromodulation therapy available on the market that is full body MRI compatible. This will change in the future, but just know Axonics was first. The implant does not have to be removed if you, for some reason, need a body MRI to look at why you may be having new back pain, you might have new joint issues, and MRIs can safely be performed when certain conditions are met if you should choose this therapy and have this implant. Axonics therapy allows you to control and help modulate your symptoms. There may be some days that you need more control. Well, you'll just take this remote that's pocket size and very easy to use, and you can adjust the settings to your current symptoms. It's easy and it's a discreet way to monitor and adjust your therapy without anybody knowing. They'll probably think you have a Tesla with a green key like that. So in terms of Axonics and its ability to be an active working therapy for 15 years, this is because it's a rechargeable system. And the charging is not a cumbersome thing. You can enjoy the freedom of charging when it's convenient, that fits into your schedule. People can charge every 1 to 2 weeks, and the charging time is 60 minutes or less, depending on how frequently you charge it. This picture shows a picture of the recharging belt, and this sitting right over the device. Women could sit down in their chair, you could watch TV, you can read. You can just take it easy while you're charging your device. Almost all patients who had Axonics implanted found that charging was very easy 1 year after therapy. 96% of patients after 1 year of implantation reported that charging in the frequency at which you had to do it and the duration is acceptable. 95% of patients reported having to only charge 7 days or less frequently. And this is an example of a patient who had a successful Axonics implant. Charging is as easy as anything. I can sit there and watch a program or read a book, and I can carry my remote control on my keychain just in case I'd ever need to use it, but I've never had to use it. The Axonics therapy is a therapy that keeps working. As your body may change over time and you may need better control, the technology and the therapy changes with you. When polled, 89% of patients who underwent Axonics therapy a year prior reported at a year they were still experiencing clinically significant improvement in their symptoms of incontinence and overactive bladder, or even their stool incontinence or bowel issues. 1 year after their implant, over 90% of patients were still satisfied with their results. 92% of patients said they would undergo the therapy again with the same expected results. And an example of another happy person after this therapy. It is just so fantastic to live a normal life. The implant procedure was much easier than what I initially thought it would be. So are you ready for symptom relief? If so, it's time to schedule a consultation. You can come in and see me and we can discuss where you are in your treatment journey, whether you're just beginning with behavioral modifications or lifestyle modifications, or you've tried medications and they haven't gotten better. We will talk with you about this therapy and determine if this is the therapy that's right for you. If you should decide that Axonics is the right therapy for you, you'll have a chance to trial the therapy through an easy test that'll let you experience firsthand if the therapy works for you. Out of all of the treatment options we have for overactive bladder, for urinary retention, for stool accidents, this is the only therapy you get to try it before you buy it. There's nothing like it in medicine. The worst you have is that you tried something. And I tell you, the majority of patients that try this therapy have an awesome result. I would say 9 out of 10 patients. So if you're interested in taking the next step towards symptom relief for your bowel, your bladder, your urinary retention symptoms, please schedule an appointment with me. Let me help you to begin to live your best life because you truly deserve it.
Thank you so much, Dr. Taylor. Welcome again, everyone. Dr. Taylor is now taking your questions. First question, Dr. Taylor, is there an age limit for the sacral neuromodulation implant?
There is absolutely no age limit, and the beauty of this device is that it's so simple to use that I even have patients with mild dementia that use the device fine. Age is not the limitation. It is just your ability to go up and down on the device setting and be able to recharge. And just to give you guys updates, on the slides, I know that we talked about recharging every 1 to 2 weeks. Well, the new battery, you only have to charge every 1 to 2 months. So it's a really easy lifestyle device, and age is not a factor in limitation.
Do any of these therapies work for bladder spasms?
Absolutely. So bladder spasms are a common term we use for overactive bladder. But what the bladder spasm is, it's just the bladder contracting to empty. And it's responding to stimulation from the sacral nerve 3. So because this therapy directly targets sacral nerve 3, it is an awesome treatment for bladder spasms. Also known medically as overactive bladder, frequency, urgency, and leakage when you can't make it to the bathroom on time or getting up multiple times at night.
Would the implant be a possible treatment for IC symptoms?
The implant is a treatment for the symptoms of interstitial cystitis, of frequency, urgency, getting up multiple times at night. It is not a treatment and not an indicated procedure for pelvic pain. Now, there is a provider in Michigan that does pudendal nerve implants for pain. But sacral neuromodulation is not indicated for pain, but definitely used with success in patients with interstitial cystitis for their frequency, urgency, and getting up to go to the bathroom multiple times at night symptoms.
Does the implant require hospitalization or a long recovery period?
No. So the implant, depending on which approach you choose to do, if you do the formal advanced trial, literally it's about a week between procedures. And as long as you're medically safe to undergo the procedure at our ambulatory surgery centers, you just come in, you get the first stage done, which takes up to an hour. You go home, you have the trial, you get to try it before you buy it. And then you come back for a very short procedure, either to put the battery in, which is the majority of patients. upwards of 85% to 90s get the battery versus pulling the lead out if you did not have a successful result. Just a 10-minute second stage procedure. Come in, go home, same day.
Can you explain the PTNS and how many sessions it requires?
So PTNS is also neuromodulation, but unlike Axonics therapy, it doesn't directly target the sacral nerve, which is the problem in bladder spasms and overactive bladder. It indirectly targets the sacral nerve through stimulating a nerve in the leg. It requires 30-minute sessions in the office once a week for 12 weeks. And if you've had a good response, you have to continue that therapy once a month.
What if I have a slow or constant leak of urine?
So the first question is, why are you leaking? All leakage of urine is not equivalent. So you have leakages that is due to bladder spasms or the overactive bladder. Then you have leakages that's due to incontinence related to a weak urethra. And the only way to be able to tell is to get your story and maybe perform some advanced testing to know exactly what is going on. If your urinary leakage incontinence is due to overactive bladder and you have tried and if you have tried and medications have failed to improve your symptoms, you are a great candidate for this therapy. And the majority of patients have a good result, and it will likely help your symptoms. But if it's due to one of the other causes of leakage, it won't improve your symptoms.
Are overactive bladder and stress urinary incontinence the same thing, and can someone have them both?
Most women have both. They are not the same thing. The only thing they share in common is the word incontinence. Overactive bladder, urge urinary incontinence, is due to the overactive sacral nerve 3 and the bladder spasming and forcing urine out. Stress urinary incontinence is due to a weak urethra. So when pressure is exerted on the bladder, urine comes out. Stress urinary incontinence is an anatomical issue that involves anatomical fixes, while overactive bladder / urge incontinence or bladder spasms are due to the functional issue of the nerve, which require addressing the nerve at the center of the problem.
Okay, I don't see any other questions. Dr. Taylor, would you like to wrap it up?
Yeah, I just want to say thank you for attending this webinar. This is really, really, really an awesome therapy that is life-changing. People who have had positive results speak so highly about the therapy, its ease of use, and the fact that it has made their lives better and they can just live. And you deserve to live, and you deserve to live your best life. So even if you're not sure if this treatment is right for you, schedule an appointment. I'm happy to talk to you about your condition and treatment options and a workup and come up with a plan that is tailored to your lifestyle.
Okay, thank you all for joining us this evening for our webinar. Dr. Taylor practices out of Chesapeake Urology's Hanover, Maryland, and St. Agnes Medical Campus office in Baltimore. She is available for in-person and telehealth appointments. For more information or to make an appointment, please visit us at chesapeakeurology.com. Thank you so much and have a great evening.
Have a great evening.